loves me again. Hi, my name is Chuck Michael, Executive Director and Primary Owner of Family Psychiatric Center here in Kokomo, Indiana. I want to do a series of informational videos. A lot of this information can be found on the web from reputable sites such as WebMD and certainly on other YouTube videos, but I just wanted to give basically my take on some frequently asked questions and some things that I tend to cover pretty frequently in therapy sessions with patients. I've been a therapist now for 22 years, and I just want to go over some recurring themes and some questions that I get pretty frequently. First of all, in going with the subject of medication, I would like to talk about what antidepressants actually are and what they do. We'll start with the most common class of antidepressants called serotonin reuptake inhibitors, or SSRIs. Simply, SSRIs block the reuptake of serotonin in the brain. Serotonin is a very important chemical in your brain because your brain doesn't have wiring. It doesn't have hard wires that run through and connect cells. Your brain has chemicals, and those chemicals are referred to as neurotransmitters. Serotonin is a very important neurotransmitter, and it can be associated, when you don't have enough of it, it can be associated with anxiety, depression, insomnia, and in general a lot of bad things.
The human brain has about 10 billion brain cells. Each brain cell can have as many as 25,000 connections with other cells. Messages, which direct many functions throughout your body, travel through your brain from cell to cell through these connections. For these signals to move from a sending cell to a receiving cell, they must cross a small gap called the synapse. Chemicals called neurotransmitters, located at the ends of the sending cells, help the signal cross this gap. Serotonin is one such neurotransmitter, a very important one that helps regulate mood, emotions, and other body functions. After the serotonin has done its job, it's reabsorbed by the sending cell and is soon back in position to help with the next nerve signal. If you have depression, you may have a serotonin imbalance. Your overall level of serotonin may be low, and some of it may be reabsorbed too soon. As a result, communication between the brain cells is impaired. An SSRI, or selective serotonin reuptake inhibitor, is a medication designed to help increase the amount of serotonin in the synapse by blocking its reabsorption. As serotonin builds up, normal communication between cells can resume, and your symptoms of depression may improve.
Important thing to remember, the only thing that these medications actually do is help block the reuptake of serotonin, meaning that when your brain kind of completes the circuit, it sucks up the serotonin. And Prozac, Zoloft, Paxil, 5 or 6 other medications commonly used in that class, all they really do is block the reuptake of serotonin and help your brain maintain a more natural level of it. So it is a human-made substance. It is not naturally occurring, but currently we don't have a way to really accurately and safely synthesize serotonin and give somebody a serotonin shot or a serotonin pill. So our best tools are these medications. One of the common misconceptions I think that I hear often out in the general public is that antidepressants numb you. They give you a numb feeling. They take the bottom end off so you're not as depressed, and they take the top end off so you can't feel happiness. The reality is if it is doing that to you, something is wrong. The medication is not supposed to be doing that. In fact, most people who take antidepressants and have a positive response to them, which are many. The majority of people who take antidepressants have a very positive response. They don't really feel like they're taking anything. They don't feel like they're on anything. Other than the fact that if they were severely depressed, it's easier for them to function, or if they're mild to moderately depressed and they go through something that's particularly stressful, they look back on it and they think, oh gee, I normally, before being on the medication, would have been a lot more upset about that, or that would have been a lot more difficult for me. So certainly in future videos, we'll talk a lot more about different types of psychiatric medications, how they're supposed to work. I wanted to start here as just a simple introduction to the class of antidepressants called SSRIs. I look forward to talking to you more in the future. Thank you very much for watching this video and giving me your time.